Okay, here we go. This is the next step, 2016 next step, chapter 4. This is the pathology and lab. So again, this will start with a little bit of wordy stuff. Good information here regarding superbills. Some people call them pink slips, encounter forms, whatever you're used to them being called. Kind of depends on where you're at in the country. This is a little bit of good information, kind of talks about a specific lab requisition form if your particular practice would use something like this. Stuff's very EMR based anymore, so how the EMR spits out these encounter forms, varies greatly. A little bit of wordy about your organ panels or disease panels. Remember, they have to have everything listed in the panel in order to code the one code. If there is something missing, then you have to code that panel completely individually. Case 4.1 just kind of goes over those panels to kind of get in your mind and get your mind used to seeing what is a part of the panels. So that's essentially what that exercise does. Most of the exercises in here are more about finding those CPT codes than very many diagnosis codes. So it's just a little bit more practice getting into these sections. Therapeutic drug assays. Different urinalysis information. This is good too. 2B will also be your drug monitoring. Chemistries. Remember the difference between your chemistries, your hematology, and your microbiology. I talked about that in the last video. Here's a lot of chem tests. This is a lot of lookup, but it's getting you into the particular areas a little bit more, so you see what's there and you're a little bit more familiar. We're going to keep going. They do have a little, be sure and read your figures to kind of get more familiar with the different parts of your lab coding. Here's your hematology and coagulation, different than your chemistries. This lab only does talk a little bit about your CBCs, your white blood cell counts, a little bit of lingo type of information. It's very good. 4.4 is hematology, just like you've gotten into your drug assays, you've gotten into your chemistries, now you're getting into your hematologies. Some coagulation. Again, very, very heavy on the looking up, but it's very good practice. Immunology, different body fluids. Sometimes we will see a lab code that says blah, blah, blah test, any fluid or any location. That means it could be body fluid, blood, tissue, So this is good information. Okay, now starting on 4.9, I'll talk a little bit about each of the exercises. This is an office testing of a UA dipstick. This is probably the most common urine test done in the offices, the UA dipstick. Case 4.10, presumptive drug class. For these, you will have to have a diagnosis code. And in this particular instance, in number 1, this particular instance, they are testing for a drug in the blood. So that's how you're going to find your Z code for the diagnosis code. Number 2, it's a drug screening for cocaine. They know that the cocaine is there. So that would be an abuse. Okay, so I'm just kind of helping you find your codes. Abuse, and then drug and cocaine. And then number 3, this is patient being brought in for a drug screen. So we're back to a Z code for that. And then you'll have to find your CPT codes. 411, the evocative suppression testing. Remember, evocative means they want to evoke a response. Suppression means they want to suppress a response. This patient has low blood pressure. And that's the reason they're having this test. So that would be your diagnosis code. Number 2 here, they have a suspected malignant tumor. We cannot code suspected. So we have to code that vision field impairment and headaches. 412, transfusion medicine. The big thing to think about here from a CPT standpoint is they did 6 units of blood, so make sure your CPT code reflects all of those units. From a diagnosis standpoint, they're doing this for a paternity test. So that would be a Z code. They're not really sick. They're doing it. They're doing a screening for a paternity test. 413, number 1. This is the patient is being brought in for a urinalysis, bacterial culture. This is being done for dysuria. Number 2, this patient has chlamydia. So that's going to get to be your diagnosis code. Now we're getting into the anatomic pathology. This is your autopsy, the necropsy codes. Into consultations, clinical pathology consultations. 415 was a little confusing because Dr. Lone Wolf, I believe, is the pathologist here. So it was a little hard for me to follow, so that's why I'm kind of throwing that out. Your first, number 1 case here is the clinical pathology CPT code for that moment in time. 4, encounter for therapeutic drug monitoring. That was why they wanted the clinical pathologist, Dr. Lone Wolf, to consult regarding the therapeutic drug levels. So this is a limited consultation, clinical pathology consultation. So your diagnosis code will be that Z code or encounter. Number 2, this is actual tissue, real pathology. So you'll need to pick your surgical pathology level, and they end up saying that it's a primary prostate cancer. So that's your diagnosis code. There's no probable or maybe. They actually gave it as the prostate cancer. Number 3, Dr. Green. This is during a surgical procedure, so that immediately tells you it's intraoperative. So you're going to use your intraoperative pathology code or codes. You're also going to have a level code. And the patient ended up having primary breast cancer. 416, this is your cytology. For severe anemia, this is actually a bone marrow sample. And then you have a chromosomal analysis here. And I believe this was just abnormal. This is just an abnormal amniotic fluid for your diagnosis code. Now we're straight into surgical path, which I think is super fun. I should have grabbed my CPT ahead of time because I want to look at the CPT on this. Case 417. This is surgical pathology. This particular, let's kind of talk about how to read these surgical pathology notes. So we know that the tissue coming in is a colon polyp. So then the gross description, we're actually going to have 5 segments or 5 pieces of tissue that are going to be looked at. It tells us down here. And then it kind of breaks it down. We have 2 larger polyps submitted, and then we have 3 smaller polyps submitted. So we have a total of 5 polyps. So that's kind of an important part for you to be able to pull out of here, because your leveling is going to have to very much reflect the different tests on the different levels that they do, or the different tissues that they do. So your level, whatever it is for a colon polyp, is going to have to reflect there's been 5 tissues that were tested. Now let's go to the pathology. Here we go. And I'm going to kind of show you how that's kind of close, isn't it? I'm going to show you how I find my levels if I don't already know. Starting with your first level, remember that's just a gross examination. Level 2, level 3, and it goes on. So what I do, I already have all of this labeled, but what I do is just kind of go down the list. I'm looking for colon polyps. So I see nothing in level 2 with colon polyps. So now I go to level 3. I do have a colon here, but it's a colostomy stoma, so that does not fit. I keep going down. I do have polyps here, but they're nasal or in the sinuses, so that doesn't fit either. So now I'm into level 4. We have a colon biopsy. So I'm going to keep my hand on that, because that's probably going to be what those polyps fall under, because they took a biopsy of the colon in order to test it, and it just happened to be polyps. And so down here, colorectal polyps. So here I've been able to find my level, 88305. So that's routinely how I look up those levels, just in a nutshell. Makes it very, very easy to do it that way. And so then back to case 417, your diagnosis code is going to be your colon polyps. That's all you know at this point. They give you the hyperplastic polyps, that's just colon polyps. Enlarged colon polyps. 418, these are just straight lab codes. 419, this is a little convoluted how they have it written out, so just kind of take it one at a time. Your diagnosis codes for number 1, 2, 3, and 4. Nope, for number 1 is going to be what's located up above here. It's going to be that GERD. Then for 2, 3, and 4, it's going to be the lab test for 50-year-old. They have a genital herpes simplex. So that's kind of how, just take it a little bit at a time. Diagnosis-wise, let me look. Okay, so like for 2, 3, and 4, patient is having multiple lab tests because of the genital herpes. So they're also checking for, they're doing a viral culture. She already has an STD. So the viral culture, I can almost swear to you, it's going to be looking for HIV, screening for HIV. This is already the herpes, so the patient's already at high risk. If you have a long-standing STD, regardless how you and I feel about that, if you have a long-standing STD, you are automatically a high-risk patient when it comes to this type of thing. Okay, so you're going to need 3 diagnosis codes here. One for the actual herpes, one for the screening, the viral screening for HIV, and one for the increased risk, patients at high risk. Again, here is your 25-year-old patient. That will be 5, 6, and 7. Oh, I remember this now. That's why, see, it confused me. So these don't put, that's right, the spiral culture was not clear enough that it was HIV. It's just for miscellaneous virus. So that HIV is going to actually go with your Western blot over here and your high risk. Sorry about that. They kind of make it really tough sometimes how they write these, but it does give you a hint here about your screening codes. So this will be your high risk and your HIV. I wrote them in the wrong thing. Sorry, one of you guys is texting me. Okay, then your lab tests for the 16-year-old, they have diabetes, so that's your diagnosis code. And your hyperlipidemia, diagnosis code for that one. And it just kind of follows through. Each little blurb will cover whatever codes are underneath there. I think the diagnosis codes are pretty clear on most of these. On 29, the blood glucose. This particular patient has some weight loss, some polydipsia, and has a family history of diabetes. So you're going to have 3 different diagnosis codes for that. For 30, your patient's morbidly obese and has excessive thirst. Probably is diabetic. And I think that's it. I think you guys, most of these you can get okay. All right, so then we get into several pages that you're actually reading off the requisition form. Okay, so they have a total bilirubin marked up here, but they've also marked this comprehensive, which has a total bilirubin in it, so you would not code extra for that. Just kind of keep that in mind. Don't code extra, because they've only pulled it once and it's within that panel. Idiopathic renal stone is your diagnosis code. And I just kind of highlighted for me the X's and stuff, so it'll help you just a little bit for your eyes. So how you would read this is anything X'd is what you're going to code for. And then your diagnosis would be down here. Same thing here. I think most of these are the same type of thing. Lots of codes on here for your osteoporosis, Meniere's disease. Okay? So you would just kind of follow through, do these. Good practice getting to look at a requisition form. Your chapter 4, auditing, and then we are done. And then we go into integumentary. So although it seems a little confusing to me how they've written some of this stuff, maybe it will not be that confusing to you. So you should do okay. Bottom line, this is just good practice getting into the path and lab section. So you guys should be good to go.